So let's begin the session. It's almost 7:02. Yeah. So good evening, everyone, and thanks for joining both of us. So today we have amongst us our speaker, Dr. Pooja Bajaj Wadhwa. So she is a qualified reproductive health specialist, obstetrician, and gynecologist, and she's an experienced consultant with over a decade of practice. And she's skilled at diagnosing and treating infertility and reproductive health issues, interfering with the couple's ability to conceive with a personalized patient specific approach. She has been working with some of the finest and most reputed medical centers in India, and she has a rich experience of over a decade. So we have with us Dr. Pooja Bajaj, and today's topic is mainly polycystic ovarian syndrome, which we will be discussing in detail. So polycystic ovarian, English हिंदी सबको okay है क्या? Please kindly I make a request कि आप अपना videos on रखिए. It can be an interactive session. तो जितना आप वीडियो ऑन रखते हैं हम भी आपको देख पाएंगे. We'll be able to solve your queries. Anyways, it's a closed group. Yeah. So kindly keep your videos on. So let me welcome Dr. Pooja Bajaj. May I request you to switch on your video, Dr. Pooja? Yeah, just 1 second.
Hi, Neha.
Hello, Dr. Pooja. So today's topic is polycystic ovarian syndrome and बहुत सारे questions आपके हमारे पास है आपके लिए. To begin, सबसे पहले तो आप can you please tell us what is polycystic ovarian syndrome? वहां से हम start करते हैं.
So, Neha, basically the thing is, see, polycystic ovarian syndrome, no, I think we shouldn't call it a disease. Neither it's like, anything pathological. It's basically, it's a syndrome, okay? We call it as a syndrome because it is affecting the woman of the reproductive age group, majorly from 25 to 45. It basically works on how the ovaries function for these women during this age group. So, when I say PCOS, the prevalence has lately increased because I think people are now more aware of what PCOS is. And
Yes.
rather than defining it in one line that I say that, this is it, it's not like that. It has multiple
Correct.
sub things and there are
Right.
multiple symptoms and features which will define it and say that, okay, so and so person has polycystic ovarian syndrome.
Right.
So, majorly 70% people they say are still undiagnosed in PCOS,
Right.
and the prevalence is 5 to 10%. But in our practice, at least with infertility, I see almost say around 20-30% is the reason behind infertility is PCOS.
Right. Right.
Big
So
number.
yeah, it's a big and it's an alarming number. And I just wanted to ask you, I was just reading about the PCOS and I was reading ki, see, I would just like to tell the audience ki incidence is the number of the new cases that are detected and prevalence मतलब जो already है वो cases existing cases क्या है वो हमें Dr. Pooja ने अभी she has enlightened us with that. So I was reading, Dr. Pooja, that the incidence is 1 out of 5 women in India.
That's true. That's true.
Quite an alarming number. So I mean, can you also tell us the symptoms that go behind it? जैसे आपने बोला कि जैसे a young girl attains puberty, there are a lot of cases which are detected early, or normally what happens is during the reproductive age group when the symptoms start showing up aggressively, that is when people get more and more aware. So what are the things, what are the symptoms that go behind PCOS?
So basically, what happens is PCOS is generally detected in the second and the third decade because, especially in adolescent girls, like for the first 2 years, we don't diagnose as someone as PCOS because initially, when the girl attains menarche, after that, it takes a year or two for things to get normalized. But after
Right.
that, still, if the symptoms persist, then we consider them at PCOS. So the
Right.
symptoms typically would include irregular cycles. Like a normal
Right.
female, her cycle length will be somewhere between 21 to 35 days. So when it is
Correct.
exceeding 35 days after the cyclic variation, that the period is coming after 35 days, or sometimes it is not coming after 35 days and it's going up to 60 to 90 days, or you have to take medicines to take periods, get your periods, that is
Yes.
what is irregular cycle. So generally, typically
Okay.
a year, if a female is having less than 8 cycles in a year, so that is
Right.
again defined as irregular cycle. So
Right.
that's the first symptom that the female would present with. Apart
Right.
from that, you will have excessive hair growth, unwanted hair,
Yes.
majorly there on the chin, or that will be
Yes.
there on the cheeks. It will be hard, coarse hair, not like the normal soft hair. Then
Yes.
a patchy like a hair growth, basically that is seen near the navel or near the in the back area. Then
Right.
really patients, these are all signs of hyperandrogenism. When I classify that, all these signs that I'm talking about, irregular cycle is number one. Number two is all these signs that includes this facial hair. Then acne is again another thing. Then the
Right.
patients generally have this acanthosis nigricans, that is, they'll have blackening at the nape of the neck or in the
Acha.
areas. So these are the typical symptoms which patient will present with.
Okay. So I mean, अभी मान लीजिए कि as a mother of a very young girl, what are the precautions that like like we are seeing children growing up or small children who are about to attain puberty. So what are the precautions or what are the things that a mother can keep in mind so that you know that because you have said that it's not a disease per se but it is a disorder, so कुछ कर सकते हैं क्या जिससे the hormonal balance can be maintained?
See, absolutely we can, and that's why we are discussing this topic today, is because we want to help people understand first how to diagnose it and then how to prevent it also. Okay, so
Correct.
that case, if you have it, then we know how to treat it. So that's how things go. So when it
Correct.
comes to young, I have a daughter who's 3 years old. So when I say that I have to tell her to do something, if I will not do it myself, I cannot expect her to do it. Like if I'm sitting with a hamburger and watching Netflix and I tell her go and play in the park, she's not going to listen to me. So I think the change
Correct.
has to start from us. We are the ones who have to actually incorporate that change in terms
Right.
of taking the kids for movies or restaurants and things like that. It's better that we actually encourage them to incorporate a sport in their day-to-day schedule or incorporate.
Absolutely.
So when I classify and tell you how to educate your children, number one would be that we have to give emphasis on exercise, a daily
Yes.
routine. Some form of physical activity has to be there. Like there's no other way out. We've all
Yes.
become potatoes, so I think we really need to understand this as a crux. Number one. Then,
Yes.
when it comes to dietary habits, there are a lot of saturated fats that we are having in terms of maida, noodles, pizzas, pastas, then sodas and cold drinks. They're not good for us. So obviously we can't stop them, but these things should be in moderate quantities. And at the same time, we also have to balance it with good and healthy diet so that even if you're doing a little bit of cheating, we are making sure that we're compensating. So that's why I say exercise becomes the most important thing, because you cannot ignore yourself like from binge eating, but at least you're burning the calories and balancing it out. So that's
Absolutely.
an important thing when we have to teach our children.
So the first thing that has come, the first message that has come from Dr. Pooja is पहले preach करने से पहले खुद practice करिए आप लोग. That first you have to make it your lifestyle habit, then that is when your children are going to follow that. Yeah. So आप पहले सिर्फ आप अपने children को push कर रहे हैं because children, the way they are trained is they look at the parent and they exactly emulate whatever is done by the parent or the guardian. So आप क्या lifestyle lead कर रहे हैं, आप क्या खा रहे हैं, इसके ऊपर आप विशेष ध्यान दें. This is the message that the first message that Dr. Pooja has given. The second message that she has given is exercising has to be a part of your routine. As I am a dentist, so how I take it is brush करने के लिए हमको dental hygiene maintain करना ही पड़ता है. So to maintain your mental hygiene and your body hygiene, you have to exercise. Yeah. So thank you. This is wonderful. Actually, this small change is very important. हम बच्चों को push करते हैं without realizing that we are actually not following those things. So
You can't expect them also to do it then, because they see what they will just do what they see. So obviously, if we are not doing it ourselves, we can't even expect them to do those things.
yes, yes. So, also, I wanted to address the mental and emotional aspect of PCOS, Dr. Pooja. इसमें क्या है कि like the PCOS patients normally जो PCOS से affected है, they have mood swings. So, and because of the hormonal instability, they have a certain body image of themselves that are not good enough. Depression sets in, anxiety बहुत रहता है, and they are not able to cope up with their emotions. जो आजू बाजू के family members है, they are not in accordance with their emotions कि भाई इस लड़की को या क्या हो गया है. So I mean, how to combat with these things, and what are the emotions normally? Can you also tell us what are the emotions that go along with PCOS? We get a better understanding of the situation.
See, I think the major emotion, majorly with PCOS, comes is insecurity, because and the comparison that you have with other peer around you, basically, that especially when it comes to acne and hirsutism, those are things which are generally, when a child is in the teenager age group and they are really affected by the peer pressure and they understand these things. Actually, education at home is very important to teach them that, okay, this is a part of growing up. Like lately, there was this news about one girl who had topped in the 10th or the 12th standard. I might be wrong in that, but I think she was having a mustache, and I
Yes.
think the entire media was just talking about that, and nobody was giving credit to the fact that she had actually topped in her session.
Absolutely. It had gone viral.
Yeah, exactly. So that was a very big message, and actually something for every one of us to know that this is what is happening, which is so wrong. And we are teaching our children the same thing. So it has to come in the family that you have to give them security of who they are. Like these things, and especially in present time, there's so many cosmetological treatments that can be done to get rid of them. But I mean, that's one part. But there has to be some comfort that they should find with themselves that, okay, even if I look this certain way, doesn't make me less
Less
than
of a
anybody
woman.
else. So that's
Yes.
woman, exactly. And these are hormonal changes which are not in her control. Like if it is there, if it's happening, the only thing you can do is make sure that you treat it the best way you can. But again, insecurity comes, then related to that, again, anger, fear, and then you don't go and express yourself because you feel you're not looking good enough.
Yes.
And especially body shaming. And also as a society, we have to understand and bring that change, rather than specifically talking about one person. It has to come from all of us.
Yes. Absolutely. And also, I also wanted to ask that, yeah, lot of young women have a lot of fear, in expressing with a partner, especially in arranged marriages, कि I'm having this condition or PCOS, because they have the fear of infertility, कि मैं conceive कर ही नहीं पाऊंगी. So, I mean, and after that, the other family where she gets married into, that also the emotional turmoil associated with it. I mean, if it really becomes ugly at certain points of time because of the fear कि I will not be able to conceive, or there'll be certain sectors of the society which have preconceived notion कि PCOS है तो भाई ये लड़की. So it makes me, and even the woman starts thinking that I may be I may have infertility issues. So it just grows strong and strong inside her system. So I mean, what are the things like? What is your expert comment on this?
See, Dr. Neha, I'll tell you with experience, there's so many times I have couples who come with a history of infertility. And I have seen one thing very common in them, which is that the female will, when she gives me the history, when she's with her partner, she'll say that, earlier my periods used to be regular. After marriage, this has happened and now it has started becoming irregular. So that's the first sign she shows of fear, because she will not accept it in front of her partner that it was already there. Because
Correct.
she's not disclosed it to her partner.
Correct.
Whereas the minute she'll go with me for an ultrasound and we are left alone to ourselves, she'll immediately tell me कि मैम मैंने ना वहाँ बताया नहीं, but मेरे को पहले से ही ऐसा होता आ रहा था.
Correct.
So this is something which I am seeing very, very honestly. This is very around us all the time. I always see this happening.
Yes.
Because see, PCOS is not something, as I started with the fact that it's not a disease. It's just a metabolic disorder. So obviously it is preventable. And taking measures and making sure even pregnancy is so normally possible with PCOS. It's just that like, how do I explain it? See, in a normal female, one egg is going to be released every month, and then that is the time when the ovulation happens. And if the husband wife are trying at that time, there's a possibility of pregnancy happening. What happens in PCOS is, because of the hormonal imbalance, there are multiple small eggs. So I would say in a layman language that the eggs get confused which one egg to send for ovulation. So that's why it ovulate, and that's the reason the patient doesn't conceive. But such people do not require very high-end treatments like IVF and all that. A simple ovulogen, like, from the starting of the period, if you're monitoring them and we give them a 5-day course of tablets of ovulogens and monitor, we can actually tell them, okay, this is how your egg has formed, and this is the time you can just try naturally and you can conceive. So, if you're more aware of it and you start facing it, it's not that big of a problem. It becomes a problem if they hide and they go on for years together, and then they come to us by the time they're 39, 40, and then that's the problem when it starts.
Absolutely. Absolutely. So simple lifestyle modifications with a few medicines. I mean, if the patients or the persons who are the partners who are trying to conceive, in certain cases or in maximum cases, with simple solutions, conception is possible, is what you are saying, isn't it?
Absolutely. It's just that they have to timely come to us, because if they are going to come late, we cannot beat the age factor. That is something which will anyways be there for every female with or without PCOS. The ovarian age number, everything is just, the ovarian reserve is going to decline with time. So that's the only problem, that if by the time they come to us, it's already they are, in a higher age group. That's the main problem. Sometimes it's not PCOS, it's the elder age group that they come. That's the
Yeah, that is the reason why I was probably thinking out loud that, after post 35, the number of eggs go on decreasing and the quality of eggs goes on decreasing. So in our tradition, it has been a practice that, girls should get into a relationship, get married early and plan a family early. I mean, I think those are the basic things because these complications are avoided. I mean, that is what I was just thinking out loud.
But I would like to correct because what we are trying to bring a point here is that this is the solution is not to get married. That's not the solution. The way is that sometimes if we are not finding the right partner at the right age, there's an option of freezing your eggs. There is an option of freezing your embryo. Suppose as a couple you decide you don't want to conceive right now. So the science come to this level today that the reason to get married should never be the fact that okay, now you should have a family. So of course, when there's so many examples that one can quote of the celebrities, but it's not something that only a celebrity can do. It's a very routine procedure that we are doing. And I'm very happy to say this, that when from a year back to now, I see a lot of awareness about oocyte freezing and egg freezing. Females understand the importance of these things now. Earlier, we would get very less number of cases. But now females come to us, at 38, 39, and they say, no, ma'am, I don't want to plan my pregnancy, or I don't want to get married for a year or two. Freeze my eggs. So that's something which is possible. And,
can you also brief us, because our audience, we have a mixed audience. So can you just tell us about the egg freezing procedure? Ki kya hai, and what is the ideal time? When can this be planned?
See, so when it comes to egg freezing, I'd say earlier the better, because obviously the more number of ovarian reserve you have, it will be good for us. I have this model, like, I thought if anybody wants to understand PCO, I'll use this.
Yeah,
So,
yeah, it's an
yeah,
absolutely
so
wonderful idea. Yeah.
if you can see it, see what happens is in every female, as I said, this is your ovary, this is the tube, and that's the uterus. Okay. So every month, one egg is going to come from here, and then if it ovulates, it is going to go through the tube. If the couple is trying, the sperm is going to come from here, embryo will be formed here, and then it gets stuck up in the uterus. Okay.
Right.
So what we do in terms of oocyte freezing is that we are going to stimulate these ovaries. So, like normally one egg is formed in here, we try whatever reserve is there, we try to
Yes.
stimulate 60% of that. So, like if I say there are 5, 6 here and 5, 6 here, we give injections, and at least out of them, out of total 12, we are able to retrieve at least 8 eggs. Like we'll give you injections from second day of period till the 12th day of your cycle, and we
Yes.
stimulate ovaries. So that we have to exaggerate it, because your normal body levels will be this, so we have to bring it a little high so that there are more eggs. And then
Correct.
when they are ready, so we don't let it ovulate inside the body, we suck the fluid out of this in a very simple procedure, which is done under short general anesthesia. It's like a 10 minutes procedure and a daycare thing. So those egg retrieval is done, and then that eggs that are there, out of that, the mature eggs, we freeze it in the embryology lab. So this can be like a backup for the female, like whenever, in case she gets married immediately or within 6-8 months, she can try naturally. But if she doesn't conceive, then she has these eggs preserved with us. So at that time, when she decides, okay, she wants to use the eggs, her husband can come and give the sample, and we can make an embryo and put it directly in the uterus. So the
Right.
procedure that is happening inside the body, we are just mimicking it and doing it outside. So the thing is that this egg age is going to be at the age when she freezes it. Like suppose she freezes it at 36 years of age, and she plans her pregnancy at 39, but the age of the egg will be 36. So definitely
Correct.
chromosomal problems and things like that, Down syndromes and things that are very prevalent today, that can be
Yes.
avoided, which
Yes.
is
Yes. So another question that comes to my mind is, ये egg freezing के बाद इसका कोई maintenance, or is there any protocol, or is it simply there with the lab, and whenever like let's say the female is 25 and she wants to conceive by the age of 35. So a decade long preservation is possible?
absolutely, you just have to make sure you're doing at the right place. Like,
Yes.
obviously, I am at Apollo. They have a lab, and then we have a system of freezing it for 10 years altogether. So that's not a problem. And, the labs make sure that the temperature is maintained. It has to be just a standard lab, which is going to be there. Like, that's the only thing you have to make sure. And if you're doing it with the right people, it's not a problem at all. I mean, years, you can keep it for more than a decade.
Okay, so yeah, we'll come to your questions also. We have a few questions from the audience, but we'll come to it. Also, I wanted to ask you is ये जब हम लोग freezing of eggs plan करते हैं, it sounds very huge. जैसे आपने बोला, it is a very small procedure and it's a day care procedure. 10 मिनट general anesthesia में करते हैं. So I just wanted to ask कि जो 8-10 दिन है, 12 दिन है, जहाँ पे injections are required for the women for the freezing process. So can the women do all the regular activities during those days? या 1 month में she needs to take certain care and precautions की bed rest ही होना है या ऐसा कुछ?
नहीं, बिल्कुल नहीं है. इनफैक्ट दीज आर ऑल मिथ्स. वी कैन जस्ट डू ऑल रूटीन एक्टिविटीज. जो पीसीओएस जिसमें होता है, उसमें क्या होता है कि ये एग्स के नंबर्स बहुत ज्यादा हो जाते हैं. ठीक है, तो
Right.
इतने ज्यादा एग्स होते हैं, जरूरी नहीं है कि वो सारे के सारे अच्छे हों, बट वो ज्यादा होते हैं तो ओवरीज थोड़ी सी वॉल्यूम में भी बड़ी होती है. ऐसे
Correct.
केस में हम लोग बस ये बोलते हैं कि ज्यादा जर्की मूवमेंट्स नहीं करना. लाइक यू जस्ट हैव टू मेक श्योर दैट यू आर अवॉइडिंग जिमिंग काइंड ऑफ थिंग्स फॉर द 15 days,
Yes.
initial 15 days, and avoid squatting or heavy weight lifting, those kind of things. But your routine day-to-day activities, going to office, doing your routine work, you're good to go. Absolutely, there's no issue. Like people come to us, they'll just come after office, They'll just come to us, we'll do a scan for them. We have to keep regulating the dose. So you have to at least visit 4 times to the hospital during the cycle. And injections, you can carry it at home, and they are so comfortable these days. They come in a pen, so you can use it on your own also. So that's
Yes.
no problem at all.
Yeah. So we have a few questions from Aparna over here. The first question is, just let me read out the question. First question is, does the quality of egg frozen decline over the time? And is it different, when you conceive naturally without freezing, is the quality of egg different? And the quality of egg which is frozen at the time, like let's say if you are 18 or 20 and you have just frozen the egg in the lab, does the quality of the egg decline or it remains the same?
So to start with, we can anyways plan pregnancy after 21 years of age. So that's the first thing. And secondly, the thing is that, if you're freezing it at a younger age group, so obviously the quality of the egg is going to be far better than what it would be at the time you plan pregnancy. So the first question
Absolutely.
is answered there and then only. When it comes to whether what would be the outcome in terms of whether you do naturally or you do it through IVF, the studies have proven that whether a couple is conceiving naturally or with IUI or with IVF, it will not vary with the outcome. Like if there is a possibility of the child having, say, some kind of a genetic issue or something, that chances would be the same whether she conceives naturally or with any other kind of a procedure. In fact, with IVF, in fact, you have the option that if there is some genetic issue, you can make sure that that thing is not inherited, and you can get the embryos tested for that specific thing so that the child does not have it. So
Which is wonderful.
which is like another add-on to it. So definitely it's
Yes.
not making you anywhere less, it's just adding up to your thing only. So definitely it's a
Yeah.
plus. It's a helping thing for us.
Yeah. So another question that has come is, are there any unusual hormonal fluctuations while going through the egg freezing treatment?
I will not say that, obviously, if you are going to be giving hormonal injections, there will be some kind of smaller, like smaller kind of symptoms. I won't say they are making any changes in your day-to-day thing, except for the fact that you might feel a little bit of bloating or some form of nausea. Some people feel it, some don't feel it. So that's the only thing. And also the injection, like if you take a prick, it's going to be that painful. So, that's the only thing.
Correct.
And that's just a 12-day thing that you have to go through. And plus the
Yeah.
needles at present today are so thin that it's just a pinch that you feel, and then after that it's gone. So I think that much we can at least bear for the result that we'll get out of it. So that's worth it.
Absolutely. Yes. Yes. So my next question to you will be, like, you have told us about the importance of exercise, yoga, and meditation. But I would like to ask your expert comment as to, I mean, by the way, I am also a wellness certified coach, a yoga teacher, and an art of living faculty who has been practicing over a decade, and I've been working with several PCOS women. So we just wanted to integrate the knowledge together so that we are able to provide a better perspective to the audience. So Dr. Pooja has told us about how exercise is going to help the PCOS women. But can you give us a little more perspective कि हम अगर exercise को, yoga को या meditation को हम regularly incorporate करते हैं जो आपने suggestion दिया था, so how is it going to help us?
See, basically, when I say exercise, it's sometimes, I'm saying the least that we can do is that at least 5 days in a week for 45 minutes is what the studies say, that this is the minimum that you should do.
Yeah.
Exercise can be in the form of, say, aerobic exercises or yoga, or just walking, brisk walking at that time, whatever is comfortable, but there should be some movement, because especially PCOS, when I talk about the technical thing, there is insulin resistance. Now that
Yes.
means that, insulin is necessary to control the sugar in the body. So it's like a vicious
Absolutely.
cycle. So what happens is that insulin resistance is there. So that is why body will secrete more insulin in order to beat that. Then after that, that is linked up to increased testosterone levels, which will prevent the ovulation and also lead to, more fat deposit. So the fat also becomes resistant. So it's like a vicious cycle, which again leads to more insulin. So it's like a round and round thing. So to
Yes.
break
So you're not able to come out of the
come out,
cycle and to
yeah.
yes,
So the
yes,
way you do it is that you make sure that you're exercising so that you keep your fat levels at a lower thing, and then your hormones are balanced. If everything is balanced, then obviously PCOS is treatable.
yes, yes. So in I have also added some information from my side over here. Let me share the screen with all of you. See, what happens is, okay, just let me give me a minute. All right. So as we have already seen, just 1 minute. Okay. So, as Dr. Pooja has already told us about the prevalence, and I've told you about the incidence that every 1 in 5 adolescent girl invariably gets detected with this syndrome. But I have seen, I was reading the research papers, the national and international publications, जहाँ पे the cause of PCOS is the etiology or the cause is still, it is multifactorial and it has not been pinpointed as yet. But there are several studies to show that if there is maternal stress, अगर आप जब like when your mother was conceiving, and if there is maternal stress, the fetal ovaries that have developed at that point of time, it becomes polycystic later during the adolescent time. So stress has been, the maternal stress has been the first point where the PCOS symptoms can manifest. All right. So PCOS can also manifest when the fetus is exposed to stress during the intrauterine period. Then you are born, and then you work, you play as a girl, as a small girl, and then we reach the teenage. So teenage में क्या होता है? So young females are exposed to a lot of metabolic stress. So Dr. Pooja can tell us a little bit more on this. So what happens is there is a HPA axis. So this is a very important axis which decides the hormonal cycle. So this causes the hyperstimulation of the ovaries, which leads to increased androgen release. So androgen release is basically, so this also can be covered a little bit more by Dr. Pooja. So this leads to multiple ovarian cysts. So multiple ovarian cysts के हमें सिम्टम्स क्या है? डिप्रेशन है, एंजाइटी है, तो इनफर्टिलिटी है, और मोर ऑफ मैंडिबुलर एक्ने, जो लोअर जॉ में या नेक में हम, यू कैन सी सिस्टिक एक्ने ऑल ओवर द फेस. So that, and your HPA axis is disturbed. So, so when these symptoms are by and large a part of your life, जैसे hirsutism हमें डॉक्टर पूजा ने बताया. Hirsutism मतलब क्या? Development of facial hair or coarse hair on the navel or in the back area. So, or you have obesity or infertility. So the feelings that come along with it is low self-esteem and worthlessness. And then you start feeling that I'm less of a woman, I'm no good. So all these feelings come along with it. Along with this, जैसे जैसे ये feelings हमारे अंदर जगह कर जाते हैं या हमारा स्ट्रेस बढ़ते जाता है, so we resort to binge eating. Binge eating होता है, sleepless nights, our sleep cycles are totally haywire, then you're always in a state of fear. Yeah. So social insecurities, जैसे Dr. Pooja had already mentioned this point, and also you have a different body image and different perception of your own body image. Yeah. So all of this, ये सब फैक्टर्स से आपका स्ट्रेस अच्छा खासा बढ़ जाता है, नेगेटिव इमोशंस बढ़ जाते हैं, इमोशनली यू आर टोटली wrecked. सो हियर व्हाट हैपेंस इज, यहाँ पे the complications that follow PCOS can be infertility or insulin resistance, or even there have been studies which prove that you are having cardiovascular complications. So what is the role of yoga in PCOS? So the asanas or the different postures are designed for PCOS. So it helps to open up the pelvic region and it promotes relaxation. So whenever the stress levels are low, you automatically have an inclination to do more. So when you do the yoga and when you do the pranayam, so pranayam, it helps you release the stress naturally. So being an art of living teacher, Sudarshan Kriya is a very powerful rhythmic breathing technique, which includes the pranayam, it includes the meditation, it includes the natural rhythmic cycles. So all of this combined together, there are two important hormones which are responsible for stress. एक है cortisol और दूसरा है DHEA, which is the dehydroendosterone androgen. So ये दो hormones are markers for stress. So there have been studies which have been conducted in controls and PCOS, and it has been found कि जो ये दो hormones है, that has been significantly increased in the PCOS women. So regular practice of pranayam, meditation, Sudarshan Kriya, and asanas. So asanas is not being a gymnast. So asanas is simply doing the things that you are able to do. Stretch your bodies, use your organs, and open up the pelvic area, open up the different parts of the body to help the body function better and promote relaxation. So Sudarshan Kriya there have been several studies which have been conducted and it greatly helps in handling the mood swings, irritability and the negative emotion. So the program takeaways are that the sleep increases, the sleep quality increases by more than 218%. So there has been, so this is a study which has been conducted by the Yale and Harvard University, where they have found a decrease of 70% in the depression rate and the stress, it reduces by 56% and immunity increases by 33%. So the next course is on the 28th for Nagpurian. For the others, I will let you know what are the online details. Yeah. And you have to start with your yoga practice. It can be aerobics. It can be a mixture of, if you like aerobics, if you like a high impact workout, it can be a mixture of strength training, yoga, and aerobics. Yeah, so that is going to work wonders for your body. So coming to the last section is I would request Dr. Pooja, is there any other information? I also wanted to, for people who are really struggling with infertility issues, yeah, जिन्हें like despite taking all the medicines or doing things right, if they are not able to conceive, what are the options available for them? Dr. Pooja, are you there?
Yes, I'm there. I'm there. Actually, just in the last 1 minute, it got disconnected.
Yeah. Just let me spotlight you. Yeah. Okay.
Yeah.
So I just wanted to ask the question, like people who have already tried the lifestyle modifications, who are doing everything right, who have taken the basic pills, and they are following everything religiously. Despite that, if there are partners or couples who are unable to conceive, so are there any treatment as a specialist for you for infertility? Can you please enlighten us on this aspect as to what are the treatment options available?
Yeah, so basically, I would suggest that, if any couple is trying for a pregnancy and they have at least tried for without any protected, without using any protection for at least a year and still they have not able to conceive. So that is when they should really meet a fertility specialist. And in case they're above 35 years of age, then even 6 months of trying and still no pregnancy is another indication. PCOS, I would also want to pinpoint here that also sometimes couple present with multiple abortions. So what
Okay.
happens is that they do have that, they've achieved pregnancy, then the pregnancy did not go forward, or there was no cardiac activity, or the pregnancy did not grow. So that's
Right.
another, like, if you have such history. So it's time that you actually meet a fertility specialist and understand, because if you come to us at an earlier time, we can be of help to you. Because if you come later, we still have options wherein you can
Right.
take donor eggs and things like that. But that's obviously the last resort. We obviously want to make sure that as long as we can use your own gametes, it's always a better option. So
Absolutely.
as soon as you feel that you're feeling such symptoms, plus otherwise also PCOS, I've already pinpointed about irregular cycles more than 35 days or less than 8 cycles in a year. Because here I would also like to add up, since we're talking about it, not only in infertility, PCOS, sometimes have long-term side effects also. Like, people who have PCOS are more prone to getting diabetes mellitus or chronic
Yes.
diseases, and even endometrial cancer, because what happens is
Yes.
this uterus lining is not shedding off. So
Yes.
as I said, when the egg ovulates, so later on the hormones will go up, and then when they go down, you get your periods. But whereas with
Yes.
what happens is it's an anovulatory cycle. So the lining
Correct.
keeps getting formed, and it reaches a point till it becomes very thick, and then you get your periods. So that
Yes.
means that is why it is not in 35 days, and it takes more than that.
Yes.
So if the female is having less than 8 cycles in a year, so you must get your endometrial lining checked, and also see for signs of endometrial cancer. So
Yes.
another thing which I would like to point out. And when it comes to going back to infertility, as I said in the beginning, it's very much treatable as long as you are aware of your symptoms and you take necessary actions for it.
Yeah. So, is there anything that you would like to add, or should I take questions from the audience?
We can take questions from the audience. I think so. That will be great.
Yeah. So, anybody from the audience, you can unmute yourself. आपको कोई questions है, तो you can please ask us questions regarding the same. Any questions from the audience? किसी को कुछ पूछना है? Any queries, any doubts?
Hi, my name is Aparna. Hello, Dr. Pooja, and hello, Neha. Thank you so much for organizing this session today. I didn't understand this explanation on the endometrial lining. I hope I got the terminology right. What
The
was the
endometrial cancer is what you're talking about?
Yes. Yeah. Could you just kind of repeat exactly what is the entire thing?
Aparna, right? Aparna. So I'll tell you what, like I used this to explain it in the beginning, that every month one egg is going to come from here, right? This is called ovulation. Now, what happens is that this ovary is going to decide, and your hormonal HPO axis is going to decide, okay, that this one egg has to come out. That is ovulation. In PCOS, there are so many small eggs. They are like, harmless, less than 8 millimeter, multiple eggs. So they look like cysts, and that is why it is called as polycystic ovarian syndrome. So what happens is they get confused. I'm talking in a very layman language. I'm not talking about hormones here. So that is why what happens is that one egg is not going to come out from it. So it's an anovulatory thing. Okay. So because this is not coming out and it's not going through the normal process, this uterus lining that is getting formed is not going to shed off on its own. Because if otherwise it ovulates and it goes through this procedure of the tube and everything, and if there's no pregnancy, then this egg gets absorbed and this uterus lining gets shed off, which is like in a normal scenario when everything is going normal. But in PCOS, this is not happening. So this uterus lining keeps getting thick and thick and thick, and there is no hormones that is balancing it. It goes to a point, becomes very, very thick, and then the female will start having some spotting after 60, 90 days, say. So when this lining is just going to be stuck up here and it's not coming out of the body, this is somewhere the problem is starting. So this causes infections, and it can also lead to endometrial cancer. So to that's why, if a female is not bleeding for at least 8 times, like at least they are not having minimum 8 cycles in a year, is a must. So you say after every 1.5 months or something, there should be a period. If you're not getting periods, then you must visit the doctor so that they can give you medicines and withdraw this thing. So for withdrawal, they'll give you a 5-day medicine. And with that, then you'll get your period so that this lining gets shed off. If it's going to stay stagnant in your body, then you have a chance to, that is a prerequisite for endometrial cancer.
Got it, doctor. Thank you. Thank you for explaining this so simply. I had another question that, a few years back when I had met one a gynecologist, and she suggested me a sonography. One of my ovaries, the right side, was detected at least swollen in shape, like it was a little bigger in shape, and was kind of concluded that probably it's indicative of PCOS. I do have the general symptoms that you mentioned in the beginning of today's session, barring the fact that my periods is regular. So is it that even in PCOS, people can be at very different stages of it? Something could be acute, something could be more, and like.
See, so I'll tell you what happens is, suppose, we say you have viral infection. So somebody will have fever, somebody will have runny nose, somebody will have cough and cold. They're all parts and parcel of the same thing, right? Similarly, when we talk of PCOS, there's a criteria. Now, getting into technical things, there's a Rotterdam criteria that we follow, in which we see at least 2 out of 3 things should be there in a female to define it and say as it is a PCOS. Number 1 is irregular cycles. Number 2 is the hyperandrogenism symptoms that I said, the hirsutism, acanthosis nigricans, that is darkening of the neck, and all the symptoms that I told you, acne and hair related, all the issues. And the third is, which we see on ultrasound. So ultrasound is what we take it as gold standard, which is PCO morphology, where on scan very clearly we can see that there are multiple follicles. As I said, I explained it in the diagram also. So normally the number is around 7 to 9. But when we see that the follicle number per ovary is more than 20, or say the ovarian volume is more than 10 cc, so that is definitely a sign and a gold standard sign to say that this female has PCO morphology. And even if you have regular cycles, but still you have acne and hirsutism and PCOM, we can define it under PCOS.
Okay, doctor. So yeah, as we discussed, and as it was shared, I think the solution is to obviously follow a very healthy lifestyles in terms of our daily exercise, having a good diet, and going about it. Okay, great. Thank you so much, doctor. Thanks a lot.
Just incorporate good numbers, amount of fiber and complex carbohydrates, and olive oil and all the things that are good antioxidants, and things that do not include this fatty acids like maida and all the ice cream, desserts, sodas, Coke, thumbs ups, all that we have. These things are not good. So we have to limit the number. And as I said that, if you commit that sin, at least balance it with exercise, because exercise is such a thing which will balance it out. At the same time, it will break the cycle also.
Absolutely, doctor. Doctor, just one more question which I had is, people generally talk about the premenstrual syndrome that women feel, with all their symptoms of, say, headaches, body cramps, mood swings, and all. So is it that women with PCOS have this much more in magnitude as compared to women not having PCOS?
Sometimes depends on various hormonal, we have to get your hormones tested. Sometimes if there is an imbalance, yes, there will be a variation, and you might feel things more than someone else. Like, sometimes.
Okay. Okay. So, gynecologist would be the right specialist to suggest if you need to take any kind of hormone test.
Yes, exactly. And if it's a little exaggerated, then there are medicines that can be given also. If it is something which is disturbing your day-to-day lifestyle to an extent of that, then you can always correct it with medicines also.
Okay. And doctor, one more thing, sometimes where, you're having these irregular cycles, some of the cases, they suggest this metformin or some kind of contraceptive pills as a course to, handle it. How safe is it for one to go through that course, especially where they are wanting to conceive, but they are going through this cycle? So, like, could you just throw some light on?
I'll tell you what. The thing is that when a patient is trying to conceive, then obviously we are not going to give OC pills. OC pills sometimes can be given before you plan your pregnancy in order to, to normalize your hormones. But when it comes to drugs like metformin and things like that, they are necessary because they're insulin sensitizer. As I told you, in PCOS, there is insulin resistance in the body. So as a result of which insulin, which is a basic hormone that is required to balance out the sugar. Now, if that is not happening and there's a resistance, your body is going to create more insulin. So basically, in order to correct that, metformin is given. So before giving metformin, we generally do a basic sugar profile and see how much of it is indicated. And otherwise, it is proven to be very helpful in ovulation. Like it can induce ovulation also. And plus, when we give medicines for ovulation, it helps in that. So that way, it's very helpful. But before giving those medicines, we do some basic testing.
Okay, doctor. Thank you very much. Thanks a lot.
Absolutely.
Okay, then we wrap up the session right now. So I have certain, like if we want to contact Dr. Pooja, I will be sharing all the details of her in the WhatsApp group because, if someone wants to get in touch with her, if they want an opinion from her, she's happy to share her details. And I would also like to thank Dr. Pooja for giving her time, for giving her valuable feedback, for giving the expert advice to all our audience. And hopefully that is helpful to the audience also, I believe, because they have been there with us. And thank you for, and I would also like to thank the audience for expressing interest and joining us for the session. Thank you so much.
So just last, I'll just say that PCOS is it's a topic very close to my heart because, something that I am seeing in my practice. And as I said, the numbers is about when they demographically say in books that 30% of the people who come to us with infertility, PCOS is somewhere an underlying factor. I think the number is a little underrated. It's far more than that. So that is why, I feel that talking about it more can bring more awareness, and then people can take necessary actions to prevent it. And if they have it also, they can just come down and take help for it rather than, just hiding it away from your partner and things like that. So I am very happy to have done this thing today with you. And I'm so happy that all of you all took such active interest and asked us questions. It's always good when it's a two-way communication and people come up with questions. It's always, you feel very good at the end of it if you get queries. So
Absolutely.
Thank you so much. Thank you, Dr. Neha, and thank you everybody for listening.
And I would also request all the participants to give your valuable feedback as to how you found the session. Up WhatsApp pe, please just write how you felt about the session. Yeah. And we'll be sharing the details of her course, of my course, her consultations, and like if you want to contact her, how you can contact, all of this I'll be sharing on the group. Also, I'll be sharing actively on the group I'm a Shri Yoga teacher. So the yoga classes or the yoga protocol, at least 2 protocols, which I would like to give for free during the yoga month, I will be sharing with you. Yeah. All right. Thank you so much.
Thank you so much. Thank you, Dr. Neha. Bye.